Hello and welcome to Bristol Health Cares. I'm your host, Kurt Barwis. I am the president and CEO of Bristol Health. This program is for you. It's really about how you navigate the system of care, how you access care, and it's really about trying to answer questions you may have and really didn't know who to ask. We are going to bring to you professionals, doctors, surgeons, other healthcare professionals throughout our system of care, maybe people that you've never talked to before or met before, but the goal is to really help you understand how to access care when you need it. You're going to enjoy this program. This program is really for you. So what's important is if there is something that you want to learn about or know about or a guest that you'd like me to host on this show, write us and we'll try to make that happen for you. So enjoy the program, Bristol Health Cares. Welcome to this episode of Bristol Health Cares. I am Kurt Barwis, your host, and I am the president and CEO of Bristol Health in Bristol, Connecticut. Today we have an amazingly exciting guest with us, Dr. Jennato. He is a podiatrist, a new podiatrist at Bristol Health. Dr. Jennato, welcome.
Thank you very much.
I'm really happy to have you here today. What is this, week 4 for you now?
This is week 4, yes.
Week 4, and you're already doing the show, which is really amazing. So tell us a little bit about yourself, where you're from, your background.
Right, so I'm originally from New Jersey, central New Jersey, Monmouth County. I graduated from podiatry school at Temple University in Philadelphia.
Oh, know that well.
Yes, and after graduating from podiatry school, I did residency at Morristown Medical Center up in Morristown, New Jersey. And then I practiced in New Jersey for about 10 years. And then for various reasons, my family, my parents and my brother ended up here in Connecticut. And it just got to be that time where I wanted to be closer to my family. And
that's great.
So I relocated up here and I'm excited to be here at Bristol.
Yeah, so it's, when you said family and often people that come and be a part, and they're a part of our Bristol Health community, they're our family. So now you've got another family that you're with. So talk a little bit about your practice. So what do you like to do in podiatry? What really gets you excited about feet? And I can't believe I actually said it that way, but I mean, you had to be excited about feet. But so talk a little bit about your practice.
Sure. So I think, first of all, feet are an amazing part of the body that are often underestimated. They're sort of the original underdogs of the body. So often, right, all day long, our feet are covered in socks and shoes and out of sight, out of mind until something goes wrong, right? Until we have pain. And so the foot is this incredibly complex structure of bones, ligaments, tendons. And with all those moving parts, there are a lot of things that can go wrong. So we really see a wide variety of different conditions in our office and day to day. So some of the common ones that we're seeing, we can start with skin disorders that we see in the feet. So common things are athlete's foot infection, fungal toenail infection, ingrown toenails, which can become infected. We can often see corns and calluses on the feet, which are very painful, especially with walking. We can see types of dermatitis, rashes, that kind of thing. And then there are issues that come up with bones. Again, a lot of issues there that are genetic, things that we inherit, such as bunions, hammer toes. Those can be very painful. And there's a whole wide range of treatments for those conditions. And then there are soft tissue conditions that we treat. Tendinitis, very common in the feet. Plantar heel pain or plantar fasciitis, what a lot of people refer to as heel spur syndrome. Very common, very painful condition. So it's a little smattering of things that we see.
That's a pretty comprehensive list, and I'm thinking to myself, well, check the box here. I've had that, I've had this. So no, I guess the way I kind of process it, when I had plantar fasciitis for years, and it was painful getting out of bed. I mean, and my wife was like, "You're like getting older too fast. What's going on there?" and then finally I went and I thought maybe I would have surgery, and then somebody talked me into doing the EPAT machine, which we have in our practice, which after having the treatment, I bought one of them.
Okay.
And it was I think I had 6 treatments, and it
Okay.
was very painful,
Right.
the treatments. But as I was going through it, the podiatrist said to me, "You're never going to have to deal with this again in your life."
Right.
And that's the thing I focused on most.
Right.
And it actually worked. I've
Yeah.
not had that problem ever
That's
again.
great.
So,
Yeah.
and I would say, all of the things that I tried, slings at night, like,
Right.
little sock things that would,
Right.
put my foot in a different direction.
Right.
I probably spent a fortune on
Yeah.
inserts and all these
Right.
other things.
Right.
And it was that simple. And
Yeah.
what I had really gone for was to have the surgery, and they talked me out of it. And it
Right.
was amazing. So,
Yeah.
anyway, so just
Yeah.
kind of a little aside,
Right.
but it made me kind of realize what you said is, your feet are such a critical part of your body. If you don't have foot health,
Right.
you're really, not going to be okay, right?
Right.
So there's a bunch of conditions too that cause all kinds of feet problems, like diabetics.
Right.
Diabetics have circulation problems.
Right.
They don't heal very fast. So we treat a lot of diabetics and stuff like that.
We do. Right.
And so talk a little bit about that.
Absolutely. So diabetics are probably the biggest proportion of patients that we're seeing every day in the office. And diabetes is a disease that has a lot of effects on the feet. Number one, through circulation, like you had mentioned. Higher levels of blood sugar can damage the walls of the arteries, so there can be problems getting enough blood flow into the feet, which has all sorts of problems in terms of healing wounds if a problem like that develops. Also, higher sugar levels damage the small nerves in the body, and so the nerves in the hands and the feet are typically some of the first areas of the body that are affected by neuropathy, which is that nerve damage. And that is a very serious condition, again, when it comes to the feet. So people have numbness, right, on the bottom of their feet. And if they're walking around barefoot, around the house, around the yard, step on something, they don't feel it right away, all sorts of problems can potentially happen. And we know that in diabetes, healing takes longer, just with problems with the immune system and circulation and other factors. So that combination of problems with the circulation and nerve damage is really a double whammy when it comes to the feet and can lead to very serious problems. So that's why it's important for diabetics to have a yearly foot exam, to have somebody check their feet, check their nerve function, and have that conversation about checking their feet every day. It's a real important maintenance thing for diabetics to do.
You were saying, sometimes with the numbness in the feet, you can be walking around and you could step on something that penetrates.
Right.
And because you can't feel it, you don't even know.
Right.
And then it can evolve into an infected area of your foot, which could then, it just kind of like is a snowball that just creates all kinds of problems. So, so every year diabetics should get checked out. How about, I used to hear people say they would go and get their toenails clipped.
Absolutely.
That's an important part for a diabetic?
That is an important part of a diabetic, right? Because again, sometimes if the toenails are not trimmed properly, right, that can lead to ingrown toenails, which can become infected. So again, in diabetics, we want to do everything we can to avoid infection, especially infections in the feet, because again, it's a more difficult part of the body to heal because of circulation and all those issues. So proper toenail care, it sounds so basic, but it's really important, right?
I didn't know. I should probably go watch a YouTube video or something to know if I'm doing it right.
There are a lot of videos out there.
I always thought it was just because, as you get older, maybe you can't reach your toes to clip them.
Right.
And I, experienced that myself, trying to figure out like what position I get in. But now that you said that, it makes me kind of step back and say it has nothing to do with that, or maybe it does a little bit. But there's a right way and there's a wrong way to do it. And now I'm questioning myself after all these years that I clip my toenails right. But no, that's I think that's really important advice for people. And and I know a lot of people do exactly what I've done all their life, and then they become type 2 diabetic or something like that, and don't process all the rest of it. And there's clearly there's a lot of other conditions that can cause numbness of your hands and your feet, like B12 deficiencies and stuff like that.
Right.
So really, as you get older, going to the podiatrist is a really critical factor. So what age is a good age to start?
Right. So for most adults, I would say in their late 50s, early 60s is when some foot problems will start to develop, pain typically. It's after years of the stress and force that go through our feet with every step that we take.
Yeah.
We can get away with a lot more younger, but as we age, it catches up with us. So arthritis will develop more in our fifth decade, sixth decade. So that's a good time to check in, whether you're diabetic or not. If you're having pain around the joints or certain tendons, another thing that develops as we age is a lower arch. Again, just the effects of gravity, our arches do tend to get lower, and that puts more strain on the plantar fascia, which is that band of connective tissue on the bottom of the foot that supports our arch. So that can be a contributing factor to plantar fasciitis as well. So flat foot is a big issue. And a lot of those conditions can be exacerbated by improper shoe gear. So another important thing for folks to know is looking at what types of shoes you're wearing, making sure that you're wearing the right shoes that fit properly. Yeah. Our feet, because our arches go down, can get a little bit longer as we age, and sometimes we think we always take the same size shoe.
Wait,
but
somebody told me our feet just don't stop growing, but now the way you've explained it to me, it's not that our feet grow,
right.
It's the arch drops and they, because I've gone up like a half a size.
Right. Yeah.
And it was after I talked to a podiatrist who said, you got to get your feet checked.
Measured. Right.
Sure
yeah.
enough, they were right. I had a half a size more, and I lost a toenail because I was wearing shoes that were too small.
Absolutely. So awesome.
But I had no idea. That's why this is a great conversation. I'm learning a lot from you. So then we talked about what other conditions, like how about high blood pressure? You mentioned.
Right. So and high blood pressure could be related to the circulation in the feet. And so circulatory problems is something that sometimes we're the first ones to diagnose for patients. Patients will come into our office and have a lot of edema or swelling in their legs and their feet. They may have varicose veins and have pain associated with that. And they'll often ask us, what's going on here? What's causing this? And it can be a number of conditions. High blood pressure, cardiac function is a big part of it, but also problems with the veins themselves, local circulation issues. So there, for example, are valves in the veins that help push the blood back up to the heart. Over time, those valves can weaken, causing more edema in the legs. So that's a sign of venous issues. And then on the other side, there can be problems with the arteries getting enough blood flow into the feet. Which
So going both ways. Can't get it out and I can't get it in.
Right,
so,
right.
How about these they have these like boots and stuff that have like air manifolds, and it starts at your foot and then it pushes the
Pumps.
blood up. I mean, we use them in the hospital post surgery for patients to make sure they don't, have a blood clot or something like that. But I see people use them, and they're advertised all over the place now. You can buy them, take them home and have a battery pack and do it. Is that something that's good for your circulation and your feet?
Yes,
you
it
recommend
is.
that?
Right, it is. Those used to be only by prescription, and now they've come so you can buy them direct. But those pumps are great for keeping that blood flow going. So
I got to be honest with you, I bought a pair for my wife and I.
Right.
So, and I researched it, and then what I really love about it is at night, because they look like ski pads.
Sure.
But it's so easy because you're watching TV.
Right.
And I bought it for my wife, but I'll bring it out because my legs are sore or something like that. She's like, "Oh, you brought them out to put them on me," and I'm like, "Well, actually, I was gonna use them myself." And so we really have it. Definitely makes all the difference in the world.
Right, and it feels good too, right? After you use it, right? It really
we travel a lot, so there's a lot of swelling, and
Sure.
when you I don't know what it is about being up in the air, but you swell a lot, and so we even got one that has a battery pack, so we can take it onto the plane with us if we're going for a long trip.
Right.
However, you got to carry the boots, which is a big thing. So, but no, really good to know. And I don't think people realize a lot of athletes use those.
Sure.
Like I think was the Olympics. I saw somebody was using them on the sideline, and they look like obviously they're Olympic athletes, and they were doing it as well. So
that post-exercise blood flow return, is important too. Yeah.
So now, so let's talk about the range of stuff you do. You do the office stuff, you see the patients. What about surgeries and stuff like that?
Right. So I do some surgeries, primarily wound care type surgeries. So I also am working in the wound care center on Friday afternoons. And so again, a lot of diabetic patients there, but not just diabetic patients. People from all sorts of issues can develop wounds in their lower extremity. So sometimes those wounds need to go to the operating room for debridement or cleaning the wound just to help with the healing process. So, that's a big surgical area that we do. And my colleague, Dr. Jean, who's also in the office, does a lot of the ankle surgery and the rear foot surgery.
So a lot of people use that word debridement. So what does that mean?
Debridement means essentially taking away unhealthy tissue at a wound. So when wounds are not healing, they're getting stuck in the healing phase where there's too much unhealthy tissue. We call that fibrotic tissue. And if that is not removed, that becomes a barrier for healthy cells to fill into the wound and continue the healing process. So debridement means taking away that unhealthy tissue to stimulate new blood growth and accelerate the healing process. And debridement can be done different ways. It can be done using a sharp instrument, so surgically doing that. And there are also enzymes that come in a sort of a gel or medicinal form that can be applied directly to the wound. And it's interesting, these enzymes can get into the wound and enzymatically debride away the unhealthy tissue and actually not harm the healthy tissue. So that's
amazing.
Yeah, it's pretty wild. The advances in wound care have been incredible over the years. Yeah,
it's funny, and so maybe this is crazy, but in the when I watch some of these old shows, like before we had all the medicine we have today, they used like bugs sometimes and to clean out the wounds, and I used to think, oh, that's like the sign that you're near the end. But the truth is, it's the same principle. Like it's amazing how it's evolved into the whole practice of medicine around cleaning these wounds, and the wounds can be very deep and almost can be fatal, I guess, for some people if they're not watched.
Right.
So 4 weeks. So talk a little bit about how you came on board.
Right.
What's it like? What's it like being in a new place 4 weeks? Because I always like it, changing. Haven't changed a job in 18 years, but that excitement, the kind of like the, I don't know, say fear, but like, okay, what's going to happen and stuff like that. So how's your first 4 weeks been?
It's been really great, Kurt. So I have to say that it is an adrenaline rush starting a new job, right?
Yeah.
And a whole new environment and new routine. So, but so far, the staff has been phenomenal. I have a great team of medical assistants at both the medical care center, and I'm also working at the office down in Southington as well. So a great team down there, and they've been a big help in kind of, showing me the ropes of where to get to radiology, where to find the different departments. So it's been really exciting.
So you're in two locations, and that Southington office, that Southington Medical Center is getting really busy.
Yes.
At this point in time, we have a lot of specialists, going through that area. So, and do you live in the vicinity now, or have you like?
So I'm just recently relocated, to Farmington, actually.
Farmington?
So
Cool.
So
that's a great place.
Close by.
Really good place.
Yeah.
So as you look to the future with your practice, how do you see your practice evolving in our community?
Right.
What kind of things do you really want to focus on and make your kind of name out of?
Sure, right. I think I really want to get involved in the diabetic care for patients. It's such a prevalent disease in this community and really across the country. And as we have an aging population, the prevalence of diabetes will be increasing even more. So I really want to help those patients with preventative care, but all the way across the spectrum to a time if they develop a wound, develop a good wound care practice to help people on that end too. So.
Yeah, so the preventative care that you're talking about is really going to see the podiatrist once a year,
Right.
getting your toenails clipped and things like
Right.
that, and having
Right.
to check up. Um, does it for child diabetics, for type ones?
Right.
So is it good for them to also do the same thing, even though they're younger, or
Right. It's still
same
good
thing
to,
apply?
almost. I mean, kids when they're really young typically don't develop the neuropathies early on in life. That typically comes later, or the longer somebody's had diabetes.
Yeah.
So kids typically don't have, again, those neurological symptoms early on, but to check in with a podiatrist once in a while would probably be a good idea, just to develop that relationship, and again, to learn about good preventative measures to watch for in their feet.
Yeah.
So
You talked a lot about neuropathy, and I think, somebody who hasn't experienced it probably doesn't understand it's a word, but it's
Right.
the nerves, and it can be incredibly painful, right?
Yes,
I mean,
right.
and actually, if it's not addressed, it sometimes can't be reversed.
Right.
So, I had neuropathy before I had spinal surgery, and my leg actually got smaller as a result until they did the surgery.
Right.
And my fear was I was never going to lose that pain, but I was lucky that I got it fast enough and was able to do that, to get back.
Right.
But I can't imagine, that was my leg and down to my knee, but I can't imagine my feet, because I felt like somebody was stabbing my leg as I was walking and stuff. So
Right.
it really can be incredibly painful.
Absolutely.
So you work with the neurologist sometimes
We
too?
do, absolutely. We'll refer patients to the neurologist. We oftentimes will start by ordering a nerve conduction study test to help determine the extent of the neuropathic symptoms, at what level, because as you were saying, sometimes it can be coming from the lower back,
Right.
can be the issue in patients who are not diabetic. So determining that cause is really important.
Yeah.
So,
this has been great, Dr. Jennato. So to wrap this up,
right.
what would you like to tell your audience, the patients, the future patients that you're going to have at Bristol Health?
Right, absolutely.
Anything?
Yeah, absolutely. So a couple of things. One, always practice good foot hygiene. It can prevent a lot of different conditions. So washing your feet well, drying your feet well, maintaining good shoe gear, just basic good hygiene can be very preventative. And in general, we all get aches and pains in our feet from time to time. But if you have an ache or a pain in your foot that's not going away after a couple of weeks or a month, come in and see us. We can check it out for you. We can do x-rays. We can work it out for you and get you better. So
Thank you so much for being here, and thank you for being so brave to come on after just 4 weeks. This is Bristol Health Cares. You can write us at cares@bristolhospital.org. Again, that's cares@bristolhospital.org. And I'm happy to bring on guests and talk about different topics. So we love to hear from you, and we will absolutely respond. So I want to special thanks to Nutmeg TV. It's a nonprofit organization, an organization that's going through some difficult times right now and needs your support. Many of you out there have cut the cable, as I have cut the cable. And a lot of the funding that took place for nonprofit programs like stations like Nutmeg TV throughout the state of Connecticut, as people transition from cable TV to the wireless or whatever it is, the other methods of getting their content, the funding has gone down and down and down. And so programs like this, like you're seeing today, and the programs that you watch on Nutmeg TV, may not be there in the future if we don't all rally behind them and help them with our support to the extent that we can. So big thanks to the production team, to Nutmeg TV, for being here, for letting us put this program on. And thanks to everyone that made this possible. Have a wonderful day. And until the next time, this is Kurt Barwis, President and CEO of Bristol Health, signing off.